Hi everyone, my name is Tarika Gates and this is a public service announcement about candidiasis, also known as a yeast infection. Candidiasis is an infection caused by a group of yeast. There are more than 20 species of Candida, the most common being Candida albicans. These fungi live on all surfaces of our body. Under certain conditions, they can become so numerous that they cause infections, particularly in warm, moist areas. Examples of such infections are vaginal yeast infections, thrush, skin and diaper rash, and nail bed infections. In women, yeast infections are the second most common reason for vaginal burning, itching, and discharge. Yeast are found in the vagina of most women and can overgrow if the environment in the vagina changes. Antibiotic and steroid use is the most common reason for yeast overgrowth, but pregnancy, menstruation, sperm, diabetes, and birth control pills can also contribute to getting a yeast infection. Yeast infections are more common after menopause. In people who have a weakened immune system because of cancer treatments, steroids, or diseases such as AIDS, candidal infections can occur throughout the entire body and can be life threatening. The blood, brain, eye, kidney, and heart are most frequently affected, but the candidal fungus also grows in the lungs, liver, and spleen. Candidal is the leading cause of inflammation in the throat in people with AIDS. Almost 15% with weakened immune systems develop a systemic illness called candida. These infections enter into the bloodstream through breakdowns or cuts in the skin or mucous membrane. Candida organisms may build up in an area because of frequent use of strong antibiotics, which kill the bacteria that normally keep it under control. Use of devices implanted in the skin, such as urinary catheters and IV ports, also provide access for the yeast to enter the body. IV drug addicts using dirty needles may inject the yeast directly into their bloodstream or deep tissues. In women, signs and symptoms of a vaginal yeast infection are a white, cheesy discharge that typically itches and irritates the vagina and surrounding outer tissues. On occasion, there may be pain with sexual intercourse or burning with urination. Oral candidiasis is called thrush. It's the thick, white, lacy patches on the top of a red base that can form on the tongue, the palate, or elsewhere inside the mouth. These patches sometimes look like milk curds, but cannot be wiped away as easily as milk can. If the white plaques are wiped away with a blade or cotton tip applicator, the underlying tissue may bleed. This infection also may make the tongue look red without the white coating. Thrush can be painful and make it difficult to eat. Care should be given to make sure a person with thrush does not become dehydrated. In people with weakened immune systems, candidal infections can affect various internal organs and cause pain or dysfunction of the organ. Most women can treat yeast infections at home with over-the-counter drugs such as monostat or femostat or vagistat vaginal. You just massage these remedies into your vagina and the surrounding tissues for 1 to 7 days, depending on the formulation. And if increased irritation occurs to the area, discontinue the medication immediately. With thrush, you usually use like nystatin, like either a cream or a mouthwash, and kind of swish it around the mouth. And for like a skin or diaper rash, you can use products like Biotine or like Boudreaux's butt paste for like babies. Nearly 75% of all adult women have had at least one yeast infection in their lifetime. It is estimated that between 5 and 7% of babies less than 1 month old will develop oral candidiasis. Among AIDS patients, it is estimated that between 9 and 31%, and in nearly 20% of cancer patients. Approximately 1 in 12,500, or 21,760 people in the U.S., are affected daily with candidiasis.